First of all, I kindly ask you to prepare the phones because I will speak Russian. Now you know that we haven't a good practice in English, but it's very pleasure for me to be here and see your good friends around and the members of Academy, because our collaboration will be stronger if we meet each other every time. It's usual for all scientific development. Thank you so much for the chance to be here with you. And of course, Professor Kasher and his team, excellent pleasure for us be here, and it's perfect organization of this quality Congress. Многоуважаемые коллеги, дорогие друзья, конечно, у онкологии нет границ.
Natural that oncology has no boundaries, and no one has a protective vest to protect us from finding ourselves in the patient's bed. This is the underlying situation, and therefore we have to change our practices in technology. We have to help each other, and everyone has to remember that anyone can find themselves in the patient's bed. In the past years, the various operations of the various organizations have strengthened, and as it turns out, I have become the leader of all three organizations: the Association of Oncologists of Russia. Under the first column, you can see the figures. They speak for themselves. You know very well that the country is very large. And the second association is the National Medical Research Radiological Center of the Ministry of Health of the Russian Federation, where I have an excellent team available who deal with nuclear medicine, amongst others. And there is an association for directors of institutes of oncology and radiology, which is also a very effective tool in our hands. And after the COVID-19 pandemic, its operations and work has strengthened and become more powerful. We know full well that there is a shortage of physicians. According to WHO data, there are 4,300,000 physicians missing from their profession. And the Association of Directors, we're talking about the post-Soviet Union member states, like Kazakhstan, etc. And in reality, we have no linguistic boundaries to speak of, because especially those from Oriental countries have studied in our country, and we harbor an excellent relationship, and they also participate in the work of our academy. The young members have an excellent command of the English language, and they are the ones who have studied abroad. As for our cooperation, unfortunately, since 2019, this cooperation has weakened somewhat, but prior to that, we have been very active, and our relationship was very active. Mr. Kashler was kind enough to mention that, and I really felt privileged that I acted as deputy director back then. But since my team is in command of vast resources, and we can involve colleagues from other organizations too into the work of the academy. What else has happened? Since 2020, our organization, our headquarters, has become a basic organization in the area of the Commonwealth of Independent States. We read the radiological security and safety programs. We develop the programs for the resident students, and amongst or in various countries, like for instance Uzbekistan, we have an exchange program, namely that our residents can study in both countries, and we mutually accept the degrees issued by each other's institutions. So our students who have graduated there can work in Russia and in Uzbekistan because our programs are so similar. I'm not saying that this has to be applied everywhere, but the standardization in the case of residence programs is very important, especially for students who deal with nuclear medicine and radiology. All of us know full well that the PET standard description is far from simple. New radiological nucleoids are appearing, so it won't be simple, but standardization is nonetheless important. I would also like to mention the fact that our institution is the reference institution in our country and in the region. It deals with pathomorphological and immunohistochemical, molecular, genetic, and radiation research methods. We are responsible for the registry. This is a cancer registry since 1948. And it operates quite well. We also have the epidemiological registry. Our professors started managing this in Omsk following the Chernobyl disaster, and in that registry there are 800,000 people included. The people who used to be workers in Chernobyl and who worked at other nuclear facilities. As for nuclear facilities, in fact, these data are not public. Nonetheless, the other data is available, accessible, and we can also publish them, which we do perform. As a reference center, we have two items. COVID-19 stimulated telemedicinal consultation, especially in our case, due to the large distances, and we also introduced medical conciliums or concilia. And since 2019, we have harbored a very active relationship in telemedicine with our Japanese counterparts, colleagues. And as you can see on the slide, we have performed this amount of telemedicinal consultations. English language consultations are of great importance. When we discuss the therapeutic protocol of patients, it is very important, and therefore the young individuals can understand who understands what and to what extent and what they can add to the entire image. So this format is indeed very interesting. We are actually developing, and I have mentioned during today and yesterday, we have a personalized approach and a personalized therapy development. We have new material, new biotechnologies substitute practices and material, and there are new researches conducted in nuclear medicine, and the results of these are highly interesting. This slide serves the purposes of displaying the therapeutic radiopharmaceuticals used in NMRRC. We are a nuclear country, and 75% of these materials are basic materials available in our country. We have excellent radiochemists, and you can see what is applied by us. Picoteran RMC. As you can see, this is the Rhine platform. The Rhine platform is very interesting because it is manufactured in Omnisk. All you have to do is cross the street. So from the Rhine platform, you can gain 15 preparates that are in the generator, and the generator is live for 6 months, which enables us to transport it anywhere in the world. These drugs, these medicines, obviously have their foreign counterparts as well, but we can manufacture them 2 to 3 times cheaper. I will shortly show you what cereals we can manufacture. You know that there are certain problems in our country. Nonetheless, if we're observing brain tumors, then in reality it's very difficult to get the colleagues to travel to us, but there are some drugs, medicines which are only manufactured in Russia. Neuroendocrinal tumors and their treatments are very interesting as well. These are chemical-resistant drugs, and we also have ready-made substances available. Docetite operates excellently in our case as well, and we also have a substance available in the case of glioblastoma, used in various tumor treatments. For intertumoral use, in fact, because we know full well that it is very difficult to remove these. What serves the purposes of our legal basis, our legal base? We have an organization, the Romnastasor. When I was the leader, we thought about how to introduce the various drugs, medicines, and use them in the case of patients who had undergone therapy previously. And we received an opportunity from the large centers to establish nuclear pharmacies, where we perform the synthesis of radionuclides. And as you can see, this is the surgery where we apply these in clinical examinations. So we do have these drugs, medicines available, and we already put them into application. And in fact, this reinforced or strengthened medical tourism in our country, which increased by 30–40%, namely, obviously, the number of patients traveling to us. But that is the maximum, because unfortunately, we have a limited amount of beds available. You can see the various drugs, medicines that we apply on the slide. Another very interesting medicine drug that we manufacture at the radiological center. This is injected into the metastases in the liver. We know it's a very difficult area to treat. You can see our results in the form of a diagram. We have extensive material available. We also have a completed publication that we can share with you. You require no protection for the application. We have an angiograph, and we have individuals available who can inject this substance into the infected areas of the liver. This is not a substitute drug, a drug that substitutes therapy. It's a supplementary treatment, and it is removed from the system in a matter of 2 or 3 days. And after 2 or 3 days, the patient is ready for low toxicity chemotherapy. We also have a laboratory, a GMP laboratory, which is a unique complex. We would actually kindly invite all of you to visit it. We would be very happy to show it to you. We manufacture cell drugs, cell medicines here. For instance, we can manufacture and blend various drugs, which is indeed very interesting. And we also perform great work during the manufacturing of the Sputnik, our vaccine. But we have mRNA-based vaccines and gamma-layer-based drugs as well. These can be used in cases of localization. And we perform clinical studies. What else have we achieved? Due to isolation in Russia, we wish to create a proton complex, which are much cheaper than the ones manufactured in the US because they employ a micro ring. This is a 40-meter room. You know what the magnetic ring is. In the proton complex, it would require an area of this size. This is the shortest or smallest ring. It was brought about, it was delivered by our Japanese colleagues, this accelerator, and we have treated some 700 patients with neck and head problems. And we will apply general radiotherapy in order to prevent early resistance. So radionuclides and the proton therapy provide us with larger maneuverability to apply a complex therapy. 177 LUTC or actinium is what we apply in the case of metastases. So we use it on an active tumor because we know that when a tumor receives pre-PET, this would be hard. Lutetium is applied in the active state, and this is only followed by the standard therapy. And this is a very promising protocol. However, we still require further observations. Innovative technologies. We work with breast tumors and microsurgical we can maintain speech actually during the treatment of the tongue, and there are very interesting studies concerning pancreatic cancer as well. Not to mention in the case of oropharyngeal applications where we have new procedures available. Many colleagues actually visit us to study these methods. What you see here are our recommendations. I do not wish to read them out loud, but if you allow me, then I would leave this presentation for the highly esteemed members of the Academy. You are free to use it. We know full well that everyone will handle it adequately. And naturally, we are readily at your disposal and open to cooperation, not to mention cooperation with the youth. Professor Hatchenko, a member of the Academy, said that we must teach students in a way that we would be willing to lie in their bed and for them to treat us. Thank you.